Good afternoon. Thank you for joining Sarah and I to talk about fetal alcohol spectrum disorder. September is Fetal Alcohol Spectrum Disorder Awareness Month, and it's very important for all helping professions to understand what FASD is and how to navigate through it to help people find services and improve their level of functioning. Sarah and I work for the Perinatal Addiction Prevention Project, and we really work to reduce the risks to mom and babies due to any substance use exposure in utero. And today we're going to focus on alcohol. So I'm going to turn things over to Sarah, who will get us started.
Thank you so much, Debbie. So like Debbie said, my name is Sarah. I work under the Perinatal Addictions Prevention Project. And today we are going to be talking about fetal alcohol spectrum disorders, otherwise known as FASDs. FASD is an umbrella term that describes a range of effects that can occur in an individual whose mother drank alcohol during pregnancy. And these can include a lot of physical, mental, behavioral, and or learning disabilities with possible lifelong implications. So the sole cause of an FASD is women drinking alcoholic beverages during pregnancy. There's a lot of different reasons for this. It's not necessarily to stigmatize people. Some reasons for this can be often women don't realize that they're pregnant until they're 6 weeks, 8 weeks, 10, 12, sometimes even later. Some people become pregnant and they struggle to stop, and other people drink to handle stress, trauma, or life circumstances such as domestic violence or human trafficking. Alcohol produces by far the most serious neurodevelopmental effects for a fetus, surpassing that of cocaine, heroin, and marijuana. And that's really important to note because I know a lot of times when we think about substances affecting pregnancy, we do tend to think immediately of those quote unquote harder drugs. Historically, a lot of different terms have been used to describe individuals affected by prenatal alcohol exposure. And this graphic is just showing how some terms are encompassed under the term FASD. So some of those terms include PFAS, which is partial fetal alcohol syndrome, FAS, which is fetal alcohol syndrome, ND-PAE, which is a neurodevelopmental disorder associated with prenatal alcohol exposure, and ARBD, alcohol-related birth defects. So this is really just to show, that it is a spectrum. It can be a lot of different things. But they are all included under this umbrella. Some facts about FASD is that it is 100% preventable, and it is the leading known cause of preventable intellectual disabilities. And like I said, it's not caused on purpose. Some people do struggle, some people just don't know, and some people are kind of caught in with myths. This can occur anywhere and anytime pregnant women drink. All alcoholic beverages are harmful, and binge drinking is especially harmful. And again, there is no safe proven amount of alcohol use during pregnancy, which does speak to some of those myths that we hear, which is, if you drink once in a while, it's okay. Or if you drink a certain type of alcohol, that's fine. But that is just a myth that kind of perpetuates throughout our lives. So exposure to alcohol during pregnancy, it takes very little alcohol to cause serious damage. And research has shown that even a single exposure to high levels of alcohol can cause significant brain damage in the infant. Some infants might suffer varying degrees of effects from a mild learning disability to a major physical, mental, and intellectual impairment. FASD is a leading cause of preventable non-genetic birth defects, and it is a permanent birth defect. Now we need some basic assumptions. Each person with an FAS or an FASD is unique, and they have their own experiences, temperament, genetics, and histories. They all have their own stories. They're all different, not to lump them in all as being the same or similar. And each person has value, and they can make a positive contribution to life regardless of their strengths and or perceived weaknesses. So what does the woman at risk look like? A woman at risk, when we think about that word, that term woman at risk, we do typically think of these stereotypes about people who use substances during pregnancy. We do tend to think that they're lower income or uneducated, all these different stereotypes that do come up. But the typical woman at risk is not necessarily what you think. The woman at risk is white, late 20s to early 30s, and college educated. And a lot of times that does have to do with this culture of social drinking. These women are people that go out with their friends, have some drinks here and there, and that is what puts them most at risk. Now, what is a standard drink? So this is helpful because often people aren't aware of what counts as one drink. So as you can see, we have 12 ounces of beer is one drink, 8 to 9 ounces of malt liquor counts as a drink, 5 ounces of wine is a drink, and 1 to 1.5 ounces of a spirit is a drink. And this is really important because if you're asking clients about their drinking habits and they're saying, oh, I have 2 drinks a night. Well, 2 drinks a night is very different when you take into account, are they drinking 2 40-ounce containers of beer at night? Because now that counts as 7 drinks. Are they drinking a fifth of vodka at night? Because that counts as 17 drinks. So it's really important just to kind of find out a little bit more information than, how often are you drinking and what are you drinking? We also need to know what is the container of the alcohol that you're drinking. We also want to go into what risky drinking levels is. So for healthy non-pregnant women, on any single occasion, no more than 3 drinks, and per week, no more than 7 drinks. For healthy men under the age of 65, on any single occasion, no more than 4 drinks, and per week, no more than 14 drinks. For healthy men over the age of 65, and a single sitting, no more than 3 drinks, and per week, no more than 7 drinks. It's also important to note that for women, 4 or more drinks within 2 hours is considered binge drinking, and for men, 5 or more drinks within 2 hours is considered binge drinking. But again, alcohol use is risky for people who are pregnant, could become pregnant, or do plan to become pregnant. Individuals who have a condition or are taking medications where that use is not advised. Any individuals under the age of 21, or individuals who have a problem with alcohol use. The reason for the difference between men and women, though, is because men have more enzymes in the liver that metabolize alcohol much more effectively than women. And as you can see at the top, we also have no alcohol use during pregnancy. There is no safe time, no safe type, and no safe amount. However, for the unborn child, it is the alcohol in the drink that is harmful. And it doesn't matter what form that alcohol comes in, be it wine, beer, liquor, light beer, non-alcoholic beer, all of these things are not advised for a fetus. Now, drinking alcohol during pregnancy, it has a lot of different effects on the fetus throughout the pregnancy period. So during the first trimester, we're seeing the lungs are being developed, the brain, the heart, those limbs, other major organs in these systems are all kind of forming. The risk by consuming alcohol is that it can cause cell damage and brain damage. In the second trimester, we do see a lot more rapid body growth and the movement is increasing. And the risk by consuming alcohol is that it can impede growth, increase the risk of miscarriage, and then poor nutrition can set back that growth of tissues and organs. In the third trimester, we're seeing, the lungs are becoming more mature and we're getting more rapid weight gain. The risk by consuming alcohol is it can lead to lower birth weight and mental delays. So some noticeable signs of an FAS or an FASD. We have a lot of different features here. We can see a low birth weight, small head, underdeveloped jaw, abnormal formation or positioning of the ears, railroad track ears, epicanthic folds in the corners of the eyes, small palpable fissures, so the eyes are either too close or too far apart, a flattened nasal bridge, a smooth philtrum, which is the indentation above the upper lip, and a thin upper lip. So as you can see in these pictures, we're noticing that small philtrum, the flattened upper lip, and the eyes, the epicanthic folds are a bit more large, wide spacing between the eyes, and they are almond shaped. Those are the 3 main features that needs to be present for a fetal alcohol syndrome to be diagnosed. But a lot of these other features, they do come with specific hearing difficulties, visual problems, and other issues with the digestive tract, cardiac issues, and kidney issues. So it is really important to kind of get that evaluated if you think, that maybe the baby has been exposed to alcohol in utero. And as you can see, here are some older people that have an FASD with the features. So we are seeing, that flattened nasal bridge, the ears kind of riding low and out, the smooth upper lip, and the smooth philtrum. So now I am going to turn it over to my pal Debbie to take us through the rest of our presentation.
Thank you, Sarah. Okay, so I'm going to focus more on how the brain can impact mental health, learning style, cognitive abilities as such. So first, if we just think simply about how our brains work when they're not short-circuiting, we're taking an input and recording that information from all our different senses. We then process that by interpreting that input, and we have to store it so that we can pull it out for later use. Then we need to respond to that input by either answering, responding, completing a task, etc. The process of this smooth operation can definitely be short-circuited with alcohol exposure in utero. Thanks, Sarah. Next slide, please. Okay. This slide really alludes to what can happen in the brain during pregnancy. First, we're just looking at the outside of the brain, and you can see that it has a lot of folds in it. In the third trimester, the brain is growing most rapidly, and it folds in on itself. The more nooks and crannies in the brain, the higher the intellectual level is, so a person's IQ. So a pregnant person who has an occasional glass of wine or beer in her third trimester, because she's been told maybe by people in her community, her family, her physician, that it's safe. An occasional glass of wine may be okay. Drinking in the third trimester can compromise the intelligence. Okay, so let's go on to other slides. If we keep clicking, please, on that slide, thank you. Okay, so some of the things that can happen as the brain's developing and it's going through an exposure to alcohol. Thanks, Sarah. They may have difficulty managing time and money. It's very hard to look at a clock that uses hands instead of a digital clock because the lines are difficult to understand that they represent increments of minutes. It may be easier for that person just to use a digital watch. It can be hard to retain information, so it can be easy to become forgetful. We're going to go into helpful hints to help with that later on. Also, a person may be functioning as someone much younger than themselves, and we'll talk about that a little bit more. It also may be very difficult to read other people's emotions and body language, which can make social interaction more difficult, and we'll talk about some more of that. Their responses may be slow or slower. They may have difficulty linking cause and effect, so really consequential thinking. If we get burnt, we tend to avoid the fire, but if it still looks pretty and attractive every time we see it, we may be putting our hand in the fire before retrieving that. It's a not safe thing to do. Maybe folks also have trouble thinking in an organized way, and we'll talk more about that because that can be really an interferent of the ability to function. People may also have trouble moving information that they learned in one situation and applying it to another. And of course, judgment can be poor with some of these things being a struggle. All right, so we can go to the next slide. Okay. This slide is important because we are trying to help reframe what you may be seeing with your clients, your patients, people in your other spheres of influence in your personal lives. We're never sure if someone has been alcohol exposed because typically it's not a visible thing. So what we may see is a person not following rules and we're thinking that they're non-compliant or attention seeking or stubborn. What may really be going on is that person has trouble translating verbal directions into action. Speech can often only be interpreted if it's literal, not figurative. So we need to be careful about our language. If I said to most people, hey, what's up? We would interpret that as a greeting and we would respond accordingly. If you say that to a person who has trouble with figurative speech and you say, what's up? They may respond, the sky, the ceiling, the lights, the stars. And it may sound as if they're being sarcastic, but truly they are responding to how they are interpreting the response, interpreting the words coming into them. I'll give a practical example of this. I have a dear colleague whose 17-year-old son did have an FASD, looked invisible. He spoke beautifully. He had a high IQ, but he had trouble with only understanding literal language. So he got pulled over because his taillight was out. He was on his way home from work one day. And the cop said, can I see your license? And this young man said, no. The cop said, excuse me, can I see your license? And the young man said, no. So of course, the next time the officer says this same statement, he pulls him out of the car and makes him hand over his wallet, and he gets hauled into the station. So my colleague gets a call from the police station, and she asked her son, Stephen, why didn't you show the cop your license? And he responded, Mom, he didn't ask for my license. He asked if he could see it, and it was in my wallet in my back pocket. He was not being sarcastic. That was his understanding. Okay, so what can we help if we're seeing people struggle with what we're communicating or asking them to do? Check level of understanding. And a good way to do this is, so when you leave here, can you tell me what are the first 2 things you are going to take care of before the end of the day? You're helping to break things down into a simple task. And let's repeat those instructions so they are able to leave the meeting with you and have a firm understanding of what they need to do or what they need to understand. Folks may often make the same mistakes. So we see that as manipulative or purposeful because they may not make the same mistakes all the time. And they may do things properly sometimes and not other times. It depends on what's going on within themselves internally and within their environment. And we'll talk about that more. And again, remember, they're not necessarily able to link cause and effect. So when we make generalizations, that doesn't necessarily work. If we say to a child, be a good girl, what does that mean? How about instead, when you can sit in your chair and not talk and look through your picture book? That's what I'm looking for. Concrete, simple steps. What does it mean to be good? Okay. So again, we're talking about providing assistance with organizing things and structuring choices so people can feel more empowered and more part of what's going on. People may seem to have a quick trigger, easily agitated. One of the things that may be impacted by alcohol exposure is the development of the corpus callosum, which is a bundle of tissues and nerves and connections that help the right and left side of the brain communicate with each other. That corpus callosum forms within the first trimester of pregnancy. So if a mom quits drinking when she knows she's pregnant, this is the type of damage that may have already been incurred. It's important to truly stop drinking before you choose to become pregnant, because this can really impact functioning. So there's poor impulse control, self-control, unable to pull up other information, all the things that interfere with a person moving forward in their developmental milestones and into adulthood. And you find if these things aren't uncovered and we don't help provide services and we don't work to function as assistants, as being people's external brains to get through the things they need to, that's how we can help people. So it's important to understand so we can refrain when we're dealing with someone who's help resistive, as it appears, agitates easily, doesn't follow through, all those things that can be frustrating to us as healthcare providers. So sometimes just by implementing these strategies, we can help a person really function in a much healthier way. And if these things go unaddressed, as folks grow into young adulthood, they are really vulnerable to suffering with issues with mental health. There can be a lot of increased depression, suicidality, as well as anxiety and other mental health issues. There may be more involvement with substance use and substance use disorders. There can be issues with the criminal justice system, whether as a victim or a perpetrator. Folks may need to be institutionalized in a treatment environment or a living environment because of their inability to function. As you can see, the list of services that people may need are never ending. And the more we can uncover what's going on with them specifically, we can address some of these needs in our own assistance with them. Okay, next slide, please. Okay, so now we're going to talk about some of the factors that can influence the ability to control behavior. And these things are not only true for someone with an FASD, they are also true for any of us throughout our lifespan. We need to pay attention to things like hunger, dehydration, nutrition, diet, okay? Our blood levels, our sugar levels spiking and dropping. Are we only waiting to feel thirsty or sweat before we drink? We need to look at what's in our foods. We need to avoid things like MSG, food coloring, nitrates, synthetic sweeteners, and other synthetic products. We need to maybe pay attention to unrecognized symptoms of illness. Often we ignore them in ourselves and it maybe affects our ability to function. And we may see things coming up in family members, friends, associates, coworkers, clients we're working with, that they're just off. Well, maybe they're getting sick, but the symptoms aren't quite present yet. I know for myself, my children were little, I could tell by their hair or the smell of their breath before they were getting sick, before they felt terrible at all. But I also got cues what was going on with their behavior, so it was easier to manage their behavior. Think about medication. It's difficult to be on medication. There may be side effects from medications, and it's easy to miss medications. And non-medication compliance, as we know, regardless of what is wrong, can really be counterproductive. This is a great time to use a reminder on your watch or your phone to not miss those doses of medication. And if they need to be supervised, then supervise. Or help someone organize into a pill box for days of the week, times a day, and we can offer to help organize in that way. We need to also think about hormones. We all have our own hormonal surges at different times. As we're growing, we certainly have many hormonal surges, and often ability to concentrate and function and sit still and manage feelings can be a lot more difficult to do when our hormones are raging, or even when we're getting older and our hormones are waning, right? Waxing, waning, well, increasing and decreasing. We also need to think about our environment and what's going on for that person. A person feeling fear or heightened anxiety is not in a position to learn well or to actively communicate effectively. Too much else is going on because we become in that fear or flight mode. So first, we may need to help people learn to self-soothe, and we're going to go into some of those ideas before we can really do some work that's productive. We also need to think about structure. A person who has struggles with time and routine and changing activities might not respond as we expect when they find out that they're getting dismissed from work early that day. They can go home because they have to somehow figure out how to self-regulate, end a task, organize to get the other things together. Now they feel stressed because they have only X amount of time to get out of the office. That's just an example of something that might come up in everyday life that many people who don't have an alcohol exposed brain will look forward to. But for others, it can be a problem. So think about your child in school and it's a half day, or you're on a special schedule because of COVID, or now all of a sudden you're home with no structure, or now you're going back to school and working on your computer, so you're working hybrid. These are things that can impact anybody that we work with, but especially for those who are alcohol exposed. Okay, and sleep, of course, is critical to all of us. And often a person's circadian rhythms can be off what might be the norm for a person's routine. So it can be very difficult to shut it off when it's sleep time and to function when it's time to be awake. So they may need assistance in finding ways to regulate that and help with more sleep. Okay, thanks. Next slide, please. Okay, these are also more factors that can influence ability to control behavior. Clothing, whether it's elastic seams or elastic in clothing, labels, certain materials. People may have heightened sensory responses to sensory input, and tactile input can be one of those areas that people are in a heightened state. So a child may not just be being willful and acting out by not wearing or complaining a lot by what you want them to wear. It really may be true that their clothing's uncomfortable. So this is a good time to choose our battles and what matters, even though it might not be how we want them walking out the door. If they're safe, it may be the way to go. That may be one of those good things to give in on. Okay, weather can impact our ability to function, whether it's the temperature, barometric pressure, right? Humidity, wind, etc. Background noises and distractions can decrease ability to function, as it can with many of us. But if you think about a healthy classroom or a clinical environment where there's stimulation all over the place, whether it's visual on the walls and there's noisy things going on and there are interruptions, or you're working on your computer because you have to as you're working with your client, all of those things can create a lot of distraction. Fluorescent lighting can also be very uncomfortable. So this could just show itself like a child who is struggling within the classroom, being in control of behavior. They go to see the principal or the counselor, and now they're in a dim office with no distractions, low lighting, not fluorescent lighting, and all of a sudden this child's back in control and functioning well. And what's very, very frustrating is that what works one day might not work the next day. So all of these things I'm mentioning, try everything you can think of to control and change if you can, and just keep thinking of more creative ideas to help with these issues as well. Okay, too much visual stimulation can be a problem. If a child responds to focused visual stimulation to help learn steps in a particular task or learn information, that can be helpful. We mentioned chaotic classroom, same goes for a chaotic household. So if you're doing home visits and the household is chaotic, it's disorganized, which again, we understand it's hard to wear all the hats we need to wear. So our position isn't to judge, but maybe we can help to come up with ways to organize. So maybe we can come up with suggestions on how to organize the kids' toys, puzzles, books, etc., just to make things easier and help the kids learn as part of their routine that when they're done, this is where it goes. So they become part of that process. It will be a lot less of yelling and getting put down or being put down or feeling frustrated, and everyone walks out of the house feeling pretty down about starting their day because things didn't go well that morning. So we need to be able to self-regulate ourselves and stay very moderate and use our own strategies to do that. As I don't know if we'll have time to go into today, but what works for them works for us too. Okay, next slide, please. Oh, I'm sorry. It just talked about name calling. Okay, describe the behavior instead of name calling and putting someone down. So instead of, you did a terrible job with that. How about instead, I see that you have this 3/4 of the way done. That's great. How can I help with getting the last part finished? You'll get it done so quickly, you'll get it done. There won't be any chaos or drama, and everyone walks away feeling a lot better than if there was name calling and put downs. Okay, thanks, Sarah. Next slide. Okay, this is important things, general issues to take away with you in regard to FASD. Often folks are undiagnosed, and they are especially undiagnosed if they do not have the facial features. And to review those, again, we are looking at features of the eyes, the smooth philtrum, the upper lip, and a thin upper lip. Okay. We see more difficulty in those without facial features and with higher IQs. So a person may be in with a full range of a healthy IQ. They may have a high IQ, or they may have a lower IQ. But if their verbal expression and their intelligence is high, that person is going to have more struggle negotiating their world. And adaptive functioning can be more an impairment than the intelligence or verbal functioning. So again, high verbal skills, intelligence, and adaptive functioning could be really impaired. So we need to look at that for our clients. So in regards to what type of professional they are, whatever background, whatever economic level, whatever education, does not matter. Anybody can be walking around. It could be any of us that may have alcohol exposure. So it's great to keep that in mind. Okay, next slide, please. All right. And Sarah mentioned this earlier. We all have strengths, and people who tend to struggle with certain learning or cognitive or interpersonal skills sometimes even come out higher in strengths like being determined and having incredible points of insight, and being wonderful with younger children because they could be functioning at half, even up to half their chronological age. So think of that person who looks normal, as normal is, that's a very general term to use. They appear to be functioning in a healthy way, but they can have a lot of struggles going on. But they may be great with younger kids, and their insight may be incredible into other people and themselves. There's a higher tendency to be kind because they understand and are sometimes more able to have less judgment. And for folks who deal with these as well, every day is a new day, which is why what works one day might not work the next day. So every day can be a brand new day that starts with a clean slate and bright and awesome. And they, as we all like to be, friendly, likable, verbal, helpful, caring, hardworking. So please keep those strengths in mind. Okay, next slide, please. Okay. This is something I think all of us as healthcare providers it's important for us as healthcare providers to create this paradigm shift for ourselves. If a client, a patient, whoever you're working with is not performing well with a lot of things maybe I mentioned, you're frustrated because there's no follow through, or it's really difficult, or things are so slow, or they seem to not be paying attention, or they're easily agitated, it is not the program that is failing the person we're working with. Okay, I'm sorry. Flip that. It is not the person failing. It is us as healthcare providers and our programming that we need to take a look at. Because if someone's not moving forward and continuing to struggle, we need to think about what we need to do differently to adapt to those needs of that person's learning style and ability to be functional. So let's always turn it into ourselves, into our practices, our programs. We're always able to improve. And as long as we address people individually and we pay attention and we incorporate a lot of these techniques in everybody we work with, we're going to see better results and we'll all complete our work days with less frustration. So I hope that you're able to use this information. Okay, next slide, please. Okay, so as we mentioned, people with an FASD may have a short trigger fuse, and some of that again is trouble self-regulating, calming down. And again, that forms in the brain within the first trimester of pregnancy. So if someone doesn't know they're pregnant and they're still socially drinking, a person may have trouble regulating their emotions and having the ability to use methods to self-soothe. So we can help by helping them create a toolbox of ways to self-soothe. And these are all applicable to ourselves as well. We don't want to say, slow down, back off, right? We want to say, I need to move into a calm space for a few minutes. Or how can I help you find a place to be calm and alone and be within your own thoughts for a few minutes? So it's not a place, go to the corner. It's not a place of punishment. It's less find your soothing place. We all are often on the road. Sometimes your car can be your soothing place if you can park somewhere pretty before you head home and take 15 minutes to yourself, or 10 minutes, or 5 minutes, whatever your schedule may allow. We're not looking to shout. We don't like being shouted out. I don't think we much like shouting. And we don't just want to walk away unless we say, I need to walk away because I might say something I don't mean. When I feel calm, can we revisit this? That's not hanging up on somebody or walking away, okay? Finding a way to say yes instead of a way to say no. So this can be with any child, any team member you're working with, any people in your other spheres of influence, your friends, your families. Any way we can avoid that word no, it's always a good thing. So think about how we adjust our environments so they are childproof for our toddlers and our young children and our pets. Well, how can we person-proof, something so we don't have to say no? If we don't want if we don't want to say no to a kid asking to watch TV, find a way to say yes to something else. Well, I know you'd like to watch, but we have time later, we have schedule for it. But right now, here's some other activities you can do instead. That's healthier, more effective than just saying, no, you cannot do something. Okay. Wait to talk it out. If you need to, yes, if you need to calm down, wait till a person is able to self-soothe, or you as the caretaker and healthcare provider is able to self-soothe before you address things. In this way, it's important to check your own presence, your own emotional barometer before you become interactive with a client so that you can be present for that client. That can help as well. And remember, when we're overwhelmed, we're go into that fight or flight mode, and it can disrupt all drained structures that we need to work effectively. We need to get calm, regain reasoning parts of the brain that are able to function and are areas of strength. And then It's really just biology. Things kick in. We need to convey love, support, care, and yes, I can help you. And if I'm not able to provide you with the service, I'm going to provide you with the information. And maybe if you have trouble setting up appointments, we can make that phone call together, if it's easier for you to set it up that way. Okay, next slide. There's a lot on that slide. So again, we're talking about this throughout this part. Maybe someone's stubborn, and maybe they can't change what they're doing. And remember, change is difficult. Someone may appear lazy. No, they try hard. What they're doing is just a lot of work in and of itself. They may appear to be lying, but more often than not, they're not sure what to say. So they just are filling in, so there isn't a silence. So very often an impulsive thought comes out just to provide that person with an answer when you're not even sure sometimes what that person's asking, because it's not asked in simple, concrete, literal terms. A person may appear uncaring. They care, but may be unable to show feelings. And any of us can be misperceived, right? We may see someone who seems to not be in good space. They're frowning a little bit. They're not smiling when it seems the social thing to do. They may not be able to show those feelings. They may not be able to connect a smile with a social gesture or maintaining eye contact, things of that nature. We may see someone who just refuses to sit still. We don't tend to do this as much with adults. We forgive adults that need to stand because their back hurts or they're getting restless leg or whatever it may be. Adults are allowed to stand because we are just not being a pain. We're still listening, right? But it could be that person is overstimulated. So we need to look at the environment and look at how we can decrease that overstimulation. Person may seem fussy and demanding. That can be any of our clients. That can be any child. That can be any adult in our lives. And it may be that they are hypersensitive. And it may be to all of our, all the sensory input that we take in and then first have to process, save, and reuse. We may appear resistant, right? You may have a client who may come across a term, it sort of describes it. It's my term. I mean it very respectfully, but they appear to have the yes, but problem, where no matter what you suggest or how you think you're presenting it in different ways, but they're still providing excuses why it cannot happen. And it really may be that they're unable to complete or they don't understand. So if we make a point of checking level of understanding, using things, other hints I'm going to get into now quickly, we can avoid that. So we all need to avoid our initial perception if what we're seeing is the column on the left. We need to work always towards level of understanding. And this helps with trauma-informed care as well. We never know what's under the surface. And we all can have stuff going on. We all may be a hot mess, and we all still function in our jobs and appear to be fine. So we just always can refrain if someone is not responding in ways that we want them to. Okay, next slide, please. All right. Reducing frustration by adjusting expectations is also important. And again, this may be redundant, but again, these are strategies we can truly use across the board. A person may not be able to consistently function at age level. So if they have a good day, they're functioning well, they may be able to get done their chores, and the next day, nothing gets done. We need to be able to look at that. Developmental age is often up to half the chronological age. So if you think of babies, we might see a gap with developmental milestones, such as sitting, crawling, walking, etc. Now think about as that person gets older, that chasm widens greatly. Look at a 16-year-old whose brain is functioning developmentally, so his interacting with people, his ability to develop his own cognitive skills. These things may only be half his age. So he's functioning, or she is functioning as an 8-year-old. Now, all of a sudden, we can be looking at dangerous situations for the person who is going through it, and for people who they are interacting with within their world. So it's important to keep that in mind. And again, as we mentioned on an earlier slide, more often than not, there are no facial features, and a person has good expressive language, but their receptive language can be difficult, and their chronological age in which they're functioning can be much lowered. So again, we want to reframe. It's not that a person cannot, I'm sorry, it's a person maybe isn't able to versus will not do. Okay, and we can help them by helping to be that external brain. Thanks. Next slide. More strategies for helping to raise level of improved behavior and to decrease any harm with learning. Use those strengths, figure out what they are and use them. If the person has a great interest in music and they can learn best through creating music or playing music or listening to music, find out what they love to do and play to those strengths. Also play to strengths for job opportunities as well. Provide opportunities to help. Again, I mentioned helping a parent or caregiver organize toys, and then also incorporate having the child help put those things away. The child's involved. I know this is a part of a lot of our parenting programs and our programs that work on developmental issues. So again, all of these things can overplay through different professions and different skills that you're working on, or with a person, or interacting with a person. Again, no blaming for limitations. What works today may not work tomorrow. So today you were able to use orange tape to mark your property so your child doesn't run off your property, and that's all great, but tomorrow just doesn't work, because at one point your child saw you step over the line to get something, and now that strategy just stopped working. So you always have to check that what you're using is being effective. Please always take advantage of those teachable moments. We all know what those are. We have them in all spheres of our life with everyone we're working with. Grab that moment in the car, driving to school, or that moment you're sharing a snack with your partner at home, whatever the case may be. Flexibility is the key. We need to be as adaptive as we can to the learning activity for the child or the adult. KISS method is always important. Keep it short and sweet. The less words, the more concrete, the more we can simplify steps, the better it's going to be. Using music, movement, drawing, visual cues, any way in which a person may learn best. And we must use humor for all of us, humor at ourselves, humor with the world, pull out our full compassion and lots of patience, because we just don't know if someone is struggling with these issues or not. So again, I really hope these things are really helpful. And this presentation, I did not mention, will be available on the website. It is being recorded. So it will be available for all to use within all the many hats they wear throughout their lifespan. Okay, next slide, please. Okay, again, we talked about this. Clear, concise directions, concrete, literal language, simplify, avoid multiple commands. A young child can often follow a 4 to 6 step direction, an adult who is high intelligence, verbal expression, wonderful, might struggle with more than a two-step direction sometimes. And other times, maybe they will be able to do a multiple-step direction. But the more we can simplify, the better outcome we'll have. Avoid multiple commands. This makes me think of training my dog, right? We have to be consistent. It's one command. It's not sit, stay, go, and all other things. Simple, concrete, right? We want a child not to be a good child. We want them to sit in the chair and not talk. Okay. Repetition, repetition. We all learn best with repetition, and check that level of understanding. Again, what do you think is going to be the first thing you do when you leave here? Okay, let's write that down. What do you think the second step is going to be? All right, write it down. You write, they write, whatever works best. Do it on a note, send it to them. Use all your forms of communication. And always, if possible, maintain eye contact while communicating. This is very difficult. We all try, I think, to maintain eye contact, but we are often multitasking. We are often in physical environments where it may not be possible. There may be cultures that are not comfortable with direct eye contact. All of this must be considered. But we do know that maintaining eye contact is one of the most effective tools for effective active listening and communication. So that's really important if you're able to. Okay, next slide, please. All right, skill training. Help people learn hobbies, new skill sets, learn how to do more things around the house, electrical work, construction work, painting, whatever skill training that we can provide. And again, role playing and repetition. Role playing can be very helpful. And if you practice enough with a child, they may be able to hang on to those words and use them as you go into another situation. Same with an adult if they struggle. Teach use of calculators, computers, short-term goals, promote those organizational skills, note-taking, make your workday workable. Let's try not to put too much on there so that we feel like a failure at the end of the day because we weren't able to check off everything on our to-do list. How do you leave enough time to be able to get from one thing to the next or to set up for the next activity? Really paying attention to that daily routine. It's so important. Use of beepers, alarm clocks. If someone has trouble switching activities, leaving one thing, going to the next, it may be your coworkers have trouble getting off their emails to make a meeting right on time. Give folks a 5-minute reminder, heads up, our meeting starts in 5 minutes, or encourage folks to set their calendars up that way to provide themselves with that reminder. Anything to help make that transition in change. Okay, consistency again, patience. We talked about helping with paperwork. It may just be too difficult and too much. I can speak for myself. Paperwork can often be overwhelming when it comes to filling out necessary documents and forms. Follow-up phone calls. It always can be difficult to fit them into your day, but if you schedule follow-up phone call, so-and-so, that check-in, and I'm sure a lot of people do that already with their clients on a regular basis, but it's always helpful to use that follow-up phone call or text as well. Okay, next slide. All right. Now we come to what is available. If you suspect someone has truly any developmental disability, doesn't even necessarily matter or not if it's diagnosed or described as a fetal alcohol spectrum disorder. We have a guide listed here that really is for families and individuals with an FASD or interacting with a person with FASD. And it goes into specialists who maybe are necessary for whatever may be wrong with that individual, whatever physical needs, hearing, vision, heart, kidneys, digestive system. Maybe someone needs help with those issues. Maybe they need a psychologist, a psychiatrist. They need occupational or physical or speech therapists. Maybe they need community support programs with caretaking and programs to help a person socialize and to be able to get out in other situations. All those types of things, social services, all of those types of things are easily listed in an index, and easy to use links are within the guide, and it can be downloaded from Human Services. And you can also find it on, I'm sorry, it's too small and I can't see what it is. If you go on to our FASD website, you can also get up on the website as well, which is fasdnewjersey.org. Excuse me, I just saw that. And other resources are available as well. In addition, Sarah and I are always available. So should you not be sure of what you're seeing, or you're just struggling with someone and maybe just want to talk it out and think through some of these strategies or look at some resources or other references, Sarah and I are available, as well as our other colleague, Roseanne. Our information, Roseanne and myself, we are on the cover slide today, so that will be available as well. And again, this webinar will be available on our CJFHC website, and everybody will be able to view that once we get that posted. I really thank everybody for your time and attention today. We just have one more slide that we can pull up. Thank you. And that is to just talk about something that's wonderful in the state of New Jersey. We are actually very lucky in New Jersey when it comes to diagnosing and case managing children who may have an FASD. We have diagnostic centers regionally that identify, screen, diagnose, provide case management, education outreach, and referrals through child evaluation centers that are in New Jersey. And here is the link that you can click on that will bring you to the one in your area. You may have to travel out of your area because appointments are hard to come by. You may need to wait quite a long time for an appointment, but you can still get in. You can also get in a little quicker sometimes if you have a diagnosis of any type of developmental disability, learning disability, cognitive disability, physical disability, and that may help get in a little bit more. But you can also call and self-refer or refer for somebody else. Unfortunately, services for people over the age of 21 are very difficult to come by. I believe that the evaluation centers are no longer able to provide free screens and the above other services to people over the age of 21. However, going into that FASD guidebook, there you can break down individuals who can work with specific problems. So if you're recognizing developmental disabilities, it will bring you to developmental specialists, etc. Okay, and I think that's the last slide. And just our references, which we would like to always make available as well. So again, I thank you all for clicking on us and taking this webinar. We are available to provide further education as well for your teams, your other community providers and stakeholders, as well as for community-based folks as well. So get in touch with us and we'd love to hear from you. Thank you.